Hello and welcome to Market Savvy Conversations. My name is Megan Walker and our very special guest today is Dr. Chajari, who is an amazing researcher that I came across in an article created by the RACGP. So hello, how are you, Lottie?
Good afternoon, Megan.
Nice to see you. And your research really piqued my interest because I thought, hey, this is something that we've all got in our handbags and our pockets, and it could be causing more harm than good. So tell us a bit about your research and your background and some of the work that you do.
Well, I'm a French citizen and Australian citizen. I am an associate professor at Bond University in the Gold Coast, Queensland, Australia. Basically, I've been interested in many types of research, especially around genomics, molecular biology. And the latest type of research that I'm doing is indeed to look at what is on mobile phones. And what I'm saying about on mobile phone, I'm looking at microorganisms. So from fungi, protozoa to viruses and bacteria. And I'm quite interested in that for a particular reason. I had like a personal kind of, let's say, a switch on of this type of research when my wife was actually initially pregnant and gave birth to my daughter. And I was at the hospital in the surgery ward because my wife was in breech. So we had to go through a cesarean. And I noticed that in the theater, there were quite a lot of medical doctors or staff or healthcare workers with mobile phones on their hands. And I was quite surprised because some of them had them with gloves on. And because I teach microbiology at Bond University and immunology and molecular biology, I was saying, oh, there is here a real red flag issue in terms of infection control. And I started to say to myself, well, I think you should do something about it and do some research on it and take a scientific angle and demonstrate that indeed those mobile phones are fomites and they should be really, let's say, handled in a different way.
Yes, absolutely. I mean, as a non-clinical person, I can already guess the risks that are posed by a surgical hand in a glove touching a phone. But can you just expand that for anyone who's new to germs? What are some of those risks for in a surgical environment, touching a phone and then touching a patient?
Look, infection control in healthcare settings, and I will actually extend that to other settings, but let's go back to the healthcare setting. The infection control is paramount so that the healthcare workers in some way treat patients without transmitting any bugs, any microorganisms towards those immunocompromised individuals. So you know that hospitals, clinics, etc., is an area where lots of people are going because of trauma or different type of infections, and their immune system at this particular time is not the best. So you really don't want to get them to be exposed to nasty bugs. And in addition to that, the healthcare settings, because there are so many individuals going there for whatever reason, obviously health issues, the healthcare settings become like a niche of many, many microorganisms, many germs. And what it means is that you can, even if you are healthy, if you enter a healthcare setting, you can actually contract a disease out there because, as I say, there is a huge, dense amount of microorganisms, which span from, as I said, viruses to bacteria. But on top of that, you have as well issues with microbes being antibiotic resistant or antimicrobial resistant. So it's really the wrong place to contract a disease. So it is important for the healthcare workers to handle patients without transmitting in any way any of those bugs to those very fragile patients.
Absolutely. And so many of the people listening to this conversation will be working in private practice. So they're GPs, they're allied health, they're specialists. Also, many of those are in and out of hospitals as well. And so would you suggest, or, would that some of those risks extend to some of those environments in clinics as well? Are we just as we need to be just as cautious in a GP clinic as we do in a hospital?
Absolutely. I mean, at the end of the day, what's happening with the mobile phones is, as we say in our different publications, they are extensions of our two hands, and I call them third hand. In addition to that, is lots of us as users never really wash or sanitize our mobile phones, and that third hand becomes a problem because we know that we touch mobile phones thousands of times a day. It's in between 2,000 and 5,000 times a day we touch those, and we use them more than 3 hours and 30 minutes. Even in some countries in South America, they use that, like in Brazil, for example, more than 5 hours a day. So it's unbelievable. We are addicted to those devices. The problem, as I said, is we never sanitize them. And the biggest problem we're facing here is that, the World Health Organization come up with the hand washing campaign, which is the greatest thing ever. I mean, as their website is stating, we're saving millions of lives by doing hand sanitization, which is great. The problem with mobile phones as a third hand, which is soiled and filthy, after you wash your hands, you touch your mobile phone while you cross-contaminate yourself all over again, because those platforms harbor all those microbes that I mentioned before. And yes, the healthcare settings could be extended to obviously any kind of clinics, even the dentist practices, even the GP practices, because with our hands, surrounding, we touch as well so many different platforms. If I take my pen right now, if I take a cup, or if I touch the doorknob, what will happen is that I would transmit microbes on my fingers. Well, as I said before, we touch our mobile phones all the time. So whatever microbes I picked in my surrounding will end up on the mobile phones. And that is bad, because mobile phones are very, very special platforms. They are not the same contaminated platforms of our surrounding, because mobile phones are platforms that we can switch on. So they got the temperature control system that allows microbes to thrive. We condense all those microbes in that little platform, the mobile phone there. So all condensed in this. And the other thing is, we eat a lot with our mobile phones. You might have had your breakfast this morning with your mobile phone, while you might have a piece of bread or whatever egg Benedict you had this morning to end up. So it might be a little debris, but for the microbes, it's a huge opportunity to feed themselves from. And what will happen here is that just by eating with your mobile phone, you give nutrients to those microbes. They are able then to replicate, to multiply, and so on. So the platforms, as mobile phones are breeding ground for all sorts of microbes. And in addition to that, we don't sanitize those particular platforms. So there is this unbelievable amount of microbes. And the last point is, when you talk over your mobile phone for communications, you spit out micro droplets. So there is a bit of saliva there, which, by the way, you contribute to an enormous amount of deposition of new microbes, from viruses to bacteria that came from your oral cavity. But the moisture is actually something that microbes also love. So you give not only a 5-star accommodation hotel for those microbes, you give a heated spa condition for those microbes. And on top of that, as I said, for the nutrients, it's actually a free buffet for all those germs to thrive.
Wow. And the extended buffet is if the phone's in a pocket with a hanky or a tissue or, oh gosh.
Absolutely. And the matter of the fact is, lots of us actually will believe that the mobile phones are indeed contaminated with microbes. I'll give you a stat. I think around 98% of the healthcare workers we've been surveying really believe those platforms do have microbes, but we don't sanitize them. And that's kind of worrisome, especially with the fact that indeed those mobile phones are mobile petri dishes.
Yes. Okay. So how, my Wordle over breakfast with my husband is now finished. What else do we need to do with these devices to protect ourselves and our patients and clients? What's your recommendation?
I emphasize the risk before going towards like an advice of what to do. The risk is extended to the fact that we indeed found bacteria as a very large amount. Our last publication found more than 4,000 bacteria in only 26 mobile phones. So coming from healthcare setting, it was actually swabs taken from the pediatric intensive care unit. So you understand that here we got a lot of immunocompromised babies around. So it's very a huge issue. And on top of that, we also found a tremendous amount of signatures of antibiotic-resistant genes. We found more than 560 antibiotic-resistant genes in those platforms. So you have here a platform that is capable actually to harbor superbugs. And the superbugs is a big issue because it means that if you get to contract one of those infections coming from those superbugs, you've got no possibility for the practitioners to treat you because they are all those bugs are indeed resistant to those antimicrobial drugs. So it becomes a huge issue. And you put that on top of that to immunocompromised individuals, you can understand that the chances are very narrow in terms of outcome and prognosis. So the matter of the fact is those mobile phones are a risk. They are circulating in billions around the world. They are in different professional settings. The healthcare setting is a huge red flag, as I said, because that would transmit in some way bugs from the mobile phones to the hands, and obviously nurses and doctors have a physical contact with the patients. So here is the risk. And as I said, those bugs not only are breeding on those platforms, but they are also superbugs. So yes, mobile phones are issue. They negate hand washing, which is another issue of the mobile phone because they are Trojan horse that we don't really think too much about. However, they negate hand washing, which has obviously the consequences to again back to the patients. So lots of problems. And indeed, the best way forward is, and this is what we're trying to do with our publications, we're taking a scientific angle to lead towards a huge awareness. And the awareness is multiple. It's not only for the community, and of course the community is important, and they need to understand that they have to clean their phones. And by the way, for one big reason again, which is that many of us actually use mobile phones in toilets.
I was waiting for you to bring this up.
So the people like you and I completely stopped doing that. Since I actually knew about what is on the surface of mobile phones, I absolutely don't use mobile phones in the toilet. I'll tell you why, by the way. We found in our last publication and many others ones anyway, E. coli at 61% of all the mobile phones were contaminated with E. coli. We had all sorts of enterococci, fecalis, faecium. We have Clostridium difficile in those. We have Campylobacter. We have Salmonella. So all sorts of, by the way, viable, all sorts of bugs that will give you a very strong infection if you had a fecal oral route. So you touch your mobile phone, you touch your face probably 20 to 25 times an hour without even you knowing about it. So you touch your mouth, your nose, or your eyes. That will be enough for an entry of those bugs. So you can self-inoculate yourself. So obviously, self-inoculation will give you the disease, but if you touch other people that are immunocompromised, the consequences are massive. So don't use, that's one of the solutions, don't use your mobile phones anymore in the toilets. Healthcare workers, they admit that probably, like with all the research we did, probably 50% of them, approximately 50% of them admit that they use the mobile phones in toilets, which is absolutely not the way to go. So back again, it's not really their fault because as I said, mobile phones are Trojan horse. So we are here to tell that be careful now, that third hand, that digital electronic device is a third hand that we need to sanitize on top of our two other hands. Yes. So the solution is what? Indeed, sanitization. And the sanitization, there are many ways to do it. Some are suboptimal. If you take like a clean felt cloth, you're not going to do much. You are going to simply get rid of some debris around it, but you will not remove the microbes that are actually attached to the surface of your mobile phone. So it's a false kind of security if you just wipe it off like that. If you use alcohol type of wipes, you have to be careful with this. First, some bugs actually can be resistant to alcohol. That's one way. The second problem is that when you use smartphones like that, if you wipe off the surface of the mobile phone, what will happen is that there is a layer right on the surface of it, which is an oleophobic layer. And what it means is when you take the alcohol wipe, you wipe it off as well. So you're not going to be able to have that kind of tactile experience that you have on smartphones. So what does it mean? And I open a bracket. I lost one phone like that because I thought it was a solution. And unfortunately, it was not anymore responsive. So I don't think anybody would like to lose their phones by cleaning it this way. And the third way is actually to look at using ultraviolet C phone sanitizers. And some of them work really well, some of them don't work at all. So there are many in the industry selling it. So obviously that will provide a lot of profits, especially with this type of research showing that they are harboring lots of microbes. But they are commercially available UVC phone sanitizers, and they are industrial grade UVC phone sanitizer. While the industrial ones that are going through a lot of certifications are really working extremely well. We're talking with some companies now from the US and Canada, especially one in Canada, where their UVC-based phone sanitization can do the job in 10 seconds. So all certified. And this is very interesting because, especially for us, because we do the research, we give the awareness of the issue, but we want to seek for a solution, obviously. So when we look at this type of solution, it becomes very practical in the field to use those phone sanitizer for one reason. If you take, for example, a healthcare worker, let's say a doctor or a nurse, the person will wash hands all the time. Obviously, this is part of the infection control. Hand wash is around 20 to 40 seconds, a kind of job. If you wash your hand and at the same time you actually slit your phone in a UVC phone sanitization, which will last 10 seconds, guess what will happen? Hand number 1, hand number 2, and hand number 3, which is the phone, will be sanitized in a simultaneous way. So you will end up having a perfect compliance adoption in the healthcare setting, and there is a lot of hospitals around here in our area that are very seduced by this type of infection control solution.
Absolutely. Wow. And do you think that, I mean, I'm asking you to forward think, but, would that end up in the domestic setting that we get?
Completely. And this is back to your questions before, like if it could be an issue in other sectors. I give you a good example. Look, we always every year hear about, COVID was there, but probably before that, we always hear about an outbreak in a boat cruise. There is an outbreak of this particular norovirus or this particular type of bacteria that leads to gastroenteritis, etc. So we hear that all the time. Now, take that example. Imagine a passenger like me, for example, having a huge gastro. I don't really say it, but I go to the toilet. I use my mobile phone in the toilet, like many of us do. And I wash my hands. Okay, fair enough. I wash my hands after using the toilet. However, I use that in the toilet. It can be cross-contaminated. Like, when you flush, you can have a plume effect where a bit of fecal material end up going in the surrounding, end up going in your mobile phone.
Wow.
You washed your hands. You think you did the right thing. Now you touch it and, it's time. I just noticed that it's time for the lunch. I go to the floor of the boat cruise where there is the buffet where everybody can actually go to. Guess what's going to happen? Well, I touch my mobile phone, which is actually contaminated. I take a bit of salmon here, a bit of pizza there. I touch my surrounding. What's going to happen? You might have here a domino effect where someone behind me touch the surface, and you end up having not one person with a gastro, but a second, then third, 3, 4, 5, because the cruise is going ahead. So it takes probably days to travel. You've got this cross-contamination. That is one big issue. And I'm trying to approach the boat cruises. Of course, I need some funding. And by the way, this is something I really need to.
Yes, I was going to ask how we can help you.
Funding is the best. We have top publications. We are on top of the field here. We've been using an incredible ability to look at a signature of all the bugs. So we look at, as I said, protozoa, fungi, bacteria, viruses, all the signatures by using what is called next generation sequencing metagenomic profiling. So we can have a full map of what is on the mobile phone. However, all of that is costing. And yes, we desperately need funding. And I'm going to tell you like another sector that we try as well to work with are the airports, for example.
I was just going to say, please be airports.
Yeah, the airports. It's. I mean, you know, I might be a little bit, let's say, a bit negative towards what we're doing in airports in terms of biosecurity control. You know, and I give you probably examples talk by themselves. Myself, when I travel from France to Australia, for example, the first thing I'm told is, do you have any, I don't know, sandwich or cheese or something like along those lines? And yes, so you obviously say, yeah, I got a sandwich there. So you show that to the biosecurity officer. And the first thing is, you know, sorry, mate, but you would not be able to take that sandwich in Australia. It goes straight to the bin. And I really respect that. I think it's fantastic because you definitely don't know what you bring in, and you have a consequence, obviously, in this beautiful country with the fauna or all the plants and so on. So I completely understand that. However, did you have any time a biosecurity officer stopping you because of your mobile phone? Never.
No,
and
never.
If I say to you that your mobile phone is a mobile petri dish, because our publications really are very, very straightforward, this is a huge amount of viable bugs that can stay on those platforms, not only for hours, not only for days, they can even stay for weeks and for months on those platforms. So it's not a trip of 14 hours or 16 hours from, let's say, Europe to Australia that is going to kill them. They are still on the mobile phone. Would you have any biosecurity officer stopping you for your mobile phone? No. Do the same thing now if you have a real petri dish and you show that to the biosecurity officer. He will stop you straight away. So the mobile phone is exactly that. And this is where there is a gap. So we're talking a lot right now. We're talking a lot about biosecurity issues. You know, you heard about the foot hand mumps disease, the Schwein virus, the monkey virus. We talk about all of this. Never do we actually think that people that cross borders have probably those particular type of microorganisms on their mobile phone. I can tell you, we found herpes viruses on mobile phones. We found there was one mobile phone from a healthcare worker that had 5 different herpes viruses: herpes simplex 1, the resolvirus 6, the resolvirus 7, the Epstein-Barr virus, the cytomegalovirus. It's an example. We found other type of viruses like human papillomavirus, 29 strains on 26 mobile phones, strains, and with a number of hits, which was quite unbelievable. And some were pathogenic, so giving you all sorts of papillomavirus type of warts. You had even viruses that lead you to cancer. We had the Merkel cell polyomavirus, which is responsible for Merkel cell carcinoma, which is a rare cancer. However, the aggressivity of this cancer is unbelievable. Like the case fatality rate is 40%. Even I think 45%. So it's very unbelievable that those particular platforms are still nowadays in 2022 a Trojan horse. And we really, and this is where the awareness is going to, is we're trying so much to get the attention of the health authorities, of the top health authorities nationally and internationally, including the Center for Disease Control and Prevention, including the World Health Organization, and the local and the national authorities here in Australia. However, we don't really have a lot of, let's say, reaction. And reaction for me is actually a bad word. I really hate reaction. I like action.
Yes, prevention.
Absolutely. That is primary prevention at its best. Yeah. I'm talking about billions of mobile phones. What we found in some healthcare settings around the region here applies to all healthcare settings in Australia, to all healthcare settings in the world, to all airports, to all boat crews, to all those kind of public areas as well. And finding more than 11,000 microbes in only 26 mobile phones with our last publication. I mean, imagine the amount of bugs that are, let's say in Australia. I think in Australia there is probably 1,300 plus hospitals, like including public and private. So if we find in 26 mobile phones more than 11,000 microbes, which is probably around 400-ish per mobile phone, you multiply that by, 600,000 healthcare workers in Australia, you end up probably with 250 million microbes right now, like as a snapshot, a little bit more than that. Right now, as a snapshot, any healthcare worker in Australia, the total amount of bugs on their mobile phones will be 250 million plus microbes, which is unbelievable. So is it that we need to do something about it? Yes, sanitization. And there are some industry right now that are desperate. Of course, they want to do business, but at the end of the day, the future for primary prevention in infection control is technology driven.
Yeah. Okay.
So if we can integrate those systems in our hospitals, in our public bathrooms, in the airports, well, it might not solutionize everything, but we will reduce the burden. And I'm going to give you another example of how we could save some money. I said before that mobile phones negate hand washing. It's a big statement. Because as I said, the World Health Organization is spending millions of dollars to make that compliant to obviously to all of us. But when you think about it, when you hand wash, which is going to be negated by the mobile phone, when you hand wash, you use around 2.2 liters of water.
Oh yes.
You spend, as I said, between 20 to 40 seconds washing your hands and rinsing your hand, and then obviously using some paper towel. So all of that, water, the time, the wipes, all of this has a huge cost. So if you take a healthcare worker, for example, applying the 5 moments of hand washing and treating, let's say, 5 individuals an hour, it means that 600,000 healthcare workers being compliant to hand washing, you're losing here 7 billion liters of water just in Australia.
Wow.
So if I say to you, mobile phones full of microbes, third hand, Trojan horse, negating hand washing, it means that all the efforts that the World Health Organization is asking us to do is wasted.
When we touch our phone.
We pay millions of dollars for staff to actually only wash their hands. If you look at the amount of shifts that are associated with only us washing our hands, let's say after 5 patients per hour and using 40 seconds of our time doing that, you're talking about millions of dollar shifts, all of that wasted. So what we need to do is stop wasting what the World Health Organization is telling us to do, because this is the right way to obviously break down the infection issues and the spread of bugs by sanitizing indeed mobile phones.
Wow. So just repeat again the device that you're suggesting will be potentially the optimum way of sanitizing the phone. Just repeat that again. What's the device?
So this is an ultraviolet C phone sanitization. And what does it mean with ultraviolet C? Is that you have like the ultraviolet C is part of particular wavelengths, which is under the normal vision that we have. So we see the things between 400 and 700 nanometer. And below that, they are the ultraviolet. So it's a range between 100 and 400 nanometer. And in that span of ultraviolet, there are 3 types of ultraviolet. There is the A, the B, and the C, which is, by the way, what the sun is radiating. But there is the ozone layer. The ozone layer stops the UVC. And if you take that UVC artificially and you use it in a platform which is enclosed, what the UVC does, it is extremely germicidal. What does it mean? Cidal means to kill. Germ. So you kill germs with this particular emission of the UVC. Now, there are some industrial-based phone sanitization using ultraviolet C in enclosed platform. So what does it mean is you are not in contact whatsoever with the emission of that UVC. All what you need to do, so imagine that my hand is a particular, there is all that sound around me, sorry. So okay. imagine you have your phone sanitizer, which has a slit. All what you need to do is to actually get your mobile phone. It will go in and being actually sanitized by the ultraviolet C. It will take only 10 seconds of the time. Wow. Your two hands are sanitized and your third hand is sanitized as well.
So can you put human hands under ultraviolet C?
You cannot. The device will actually stop you from, will stop from functioning. It will be only the device.
I was going to say we could save all that water as well, but that's a conversation for another day.
They are actually, the water is sterilized by ultraviolet C as well. Yeah,
okay. Oh, wonderful. All right. Well, amazing. When I saw your article, I thought, oh, look, I'm in the world of healthcare marketing and health promotions, but when I saw it, I just went, this is a message that we obviously desperately need to share. What's the next steps in your research journey? And if a clinician, practitioner, therapist is listening, where can they go to follow what you're doing and learn more?
So as you mentioned before, we are backed up by the Royal Australian College of GPs, and there is a study that we want to do at GP clinics. So that's one of the other thing I would like to do is to have a kind of similar type of research in dentist practices as well as airports. I think this is very important. And for me, the limiting factor I have, and if there is any of your listeners or readers or members that can help us fundraising or giving us some support in that respect, it's one thing that will make the things go forward. The second thing as well that is going to be quite important is to have that link to talk with the public health authorities. So whoever has connections above so that it can facilitate a conversation between our team and them, that will be absolutely amazing. Obviously, we're taking a scientific angle, so they are all published in peer international review journals, scientific one, of course. And yes, indeed, that will help quite a lot.
Beautiful. Okay. Public health decision makers. Wonderful. All right. That's amazing. Dr. Tajiri, thank you so much. Was there anything that you wanted me to ask you that I haven't? Any other points? Oh, I know what I was going to ask you. So in the meantime, while we're waiting for UVC to get in our hands, what's better than what we're doing now? Get rid of hankies and tissues?
So I didn't probably grasp your question. Can you just repeat it?
Oh, yes, of course. What are some better things we can be doing while we're waiting for UVC to become available? What are some better practices with our phones in the meantime?
Actually, they are already available, so it's just a matter actually to buy those. And I'm trying to connect with some of those companies to give me free sample, because obviously research-wise we don't have lots, as I said, money. Yes. So we're trying to seduce them to let us use the system so that we can compare them. And this is one publication I'm trying to finalize now. We've been using 3 different company UVC phone sanitizer, and we compare those. And of course, some of those companies don't really like that because they're afraid that their system are suboptimal. And we found 2 of those companies that where it's not working. And a third company works beautifully, which is, by the way, the one that I told you about from Canada. So yes, those are available. And right now, what we should be doing is to, as I said, first of all, don't use mobile phones in toilets. Second is to understand that they are actually platforms for bugs, and probably don't give it to your, daughter or toddler to play with, because if they leak through your mobile phone, and previously it's been used in toilets or have never been sanitized, which is the case for many, you might actually get that kind of entry of bugs to your loved ones. And thirdly is indeed when you think you are going to touch something important, or wash your hands because you've been just touching your mobile phone. And I really will not advise to clean this with alcohol. If you want to lose your mobile phone at one stage, why not? But yeah, be careful in doing so.
Yes, wonderful. Oh, thank you so much for your time today. It's been so
You're
wonderful talking to you. And we'll put your contact details where people are watching the video if they want to get in touch. And certainly direct any public health decision makers. I'm thinking Telstra Health, anyone who's got a checkbook handy, we want to send them to Dr. Tajiri's direction.
Would be great. And even, I mean, if people have connections with airports and obviously those authorities, we are absolutely willing to do those experiments, and we can share the data obviously with them so that we have the best biosecurity type of prevention, and same for the healthcare system and same for the public spaces. Wonderful. Let's all go and wash our hands now. Thanks again so much for your time. Bye now. Bye. Bye-bye.